Hello everyone. So today we are going to start our new chapter, which is nothing but the roots of drug administration and dosage form. So in this chapter we are going to discuss not only the roots for the drug administration but also the various factors which governs the choice of the route, as well as the dosage forms like sustained release formulation. So the question comes, what is mean by the dose? The dose is nothing but it is the appropriate amount of the drug needed to produce a certain degree of response in a patient. It is appropriate amount of drug needed to produce a certain degree of response in a patient. Hence, the dose of the drug depends on response which is desired. So, better example is aspirin. Aspirin is known as analgesic as well as the anti-inflammatory drug. Means it gives the analgesic action along with the anti-inflammatory action. But for analgesic action, the drug is sufficient for the person is we can say that 0.3 to 0.6 gram of the drug daily is sufficient to give the analgesic action. But if we require the anti-inflammatory action in case of the diseases like the rheumatoid arthritis, then dose required is more. So this dose is ranging between the 3 gram to 6 gram per day. So depends upon such a type of the response, or the we can say that degree of response, the doses will be prescribed. So there are many factors actually which governs the choice of the route. First factor is the physical and chemical properties of the drug, whether the drug is a solid, liquid or gas, the solubility of the drug, again the pH of the drug, then factors like the irritability of that particular drug, means it is having the bitter taste, then irritating odor. It also governs the choice of the route, because if it having the bitter taste, then it must be sugar coated when it is administered by the oral route, or it is capsulated when it is administered by the oral route. So such a type of factors actually governs the choice of the route. Next one is the site of the desired action. Site of the desired action means it is a localized, we require the localized action or the generalized action. Means where the actually the illness is there, that particular site, त्या साइडलाच फक्त इफेक्ट आवश्यक असेल किंवा अख्ख्या बॉडीला आवश्यक असेल, इट्स ऑल्सो डिसाइड द चॉइस ऑफ द रूट. नेक्स्ट वन इज द रेट अँड एक्सटेंट ऑफ absorption of drug from various route. Because if we require a specific rate or we require more absorption into blood stream, it also decide, because when we are taking any drug by the oral route, simple way, oral route ने जर का आपण एखादा ड्रग घेतलं oral route ने, तर actually drug which is administered and drug which is a bioavailable in a blood stream is different one, and actually bioavailability definitely less than the drug which is administered by the oral route. So it also governs the choice of the route. Next one is the effect of digestive juice on drug metabolism. Many times the digestive juice actually either decompose, either converts the compound, drug compound into different compound which is not drug. So it cannot give the desired effect. A well-known example is a hypoglycemic agent which is nothing but the insulin. So there are some peoples which cannot there are some peoples which are suffering from the diabetic condition, means they cannot produce or their pancreas cannot produce the insulin. In that case actually insulin is given externally to that particular patient. So oral route is available, but the thing is that when the insulin is given by the oral route ने जेव्हा insulin दिलं जातं त्यावेळेला what's happen, when the insulin given by the oral route, that insulin get converted to the another product. So there is no another choice, that drug should be given by the injection or the parenteral route only. Okay, so next point is, or next factor, which is nothing but the rapidity with which the response is desired. Means response required within a minute, within an hour, within a day, or within a second. It also decides the choice of the route. Okay. Next one is accuracy of dosage form. So previously we discussed when the drug is given by the oral route, actually drug which is become available in a bloodstream is less than drug which is administered. Okay. So if we require the accurate dose, then we have to go for the another route for drug administration than the oral route of drug administration. Okay. Next one is the condition of patient. Suppose the patient is unconscious one, बेशुद्ध असलेला पेशंट आहे, त्याला आपण गोळी औषध कसं देणार तोंडावरती, आपण त्याला गोळी किंवा औषध देऊ शकत नाही. इन दॅट केस ऍक्च्युअली वी हॅव टू कन्सिडर द कंडिशन ऑफ द पेशंट. सो देर इज नो अल्टरनेटिव्ह टू यूज द routes other than the oral route. Okay, so these are actually the 7 factors which decides the choice of the route. So these are the factors which decides the choice of the route. Then here we are going to consider the which are actually the routes by which actually the drug is administered in our body. Okay, first actually route is the oral route, which is a familiar route, and it is a very simple route. Tablets, capsules, any type of syrups, emulsions, some powders are also taken by the oral route. Okay, तोंडावाटे जी गोष्टी घेतली जाते is nothing but the oral route of drug administration. Next one is a parenteral route. Actually is not parenteral route, is a parenteral route. Parenteral route means actually the route other than the oral route. Means bypass gastrointestinal tract ला bypass करून जो route वापरला जातो, all these routes are considered as parenteral route. Then next one is a topical route. Topical route means application of powder, application of emulsions on the surface of the skin. वरती लावणाऱ्या ज्या गोष्टी, वरती लावण्याची जी औषध आहेत वरून अप्लाय करण्याची, त्याला म्हणतो आपण टॉपिकल रूट. नेक्स्ट वन इज अ सबक्युटेनियस रूट. means is a injection but it given in upper layer of the actually the skin, त्यामुळे म्हणतो आपण त्याला सबकट रूट किंवा सबक्युटेनियस रूट. Next one is a nasal route. We are familiar with that. We are using number of inhalers like the Vicks inhaler in nasal congestion. So that route is nothing but the nasal route. Asthmatic patients ला जी औषधं दिली जातात ती nasal route ने दिली जातात. त्यांचा जो रोटाहेलर असेल किंवा इनहेलर जो वापरला जातो अस्थालींचा, which is actually useful or utilized for the nasal route. And next one is a rectal route. So drug or drug suppositories especially directly inserted into the rectum. So especially the patient maybe having the problem of constipation related diseases. In that for that patient actually rectal route is applied. So here you can see that actually the nasal route, then this one is A, which is nothing but the tablets are given to the oral route. Then the inhaler, which is useful for the nasal route, and next one is a subcutaneous route and transdermal route. Okay, so we are not discussing here transdermal route. We are moving towards the next point, which is nothing but the advantages of oral dosage form. What are the advantages of the oral dosage form? As compared to other form, oral dosage form is a very simple form. Okay, so first application of oral dosage form is appropriate for any patient, whatever the age is. So irrespective with the age, this is suitable for every patient. Next one is the most natural and easiest route of administration. Because naturally we are eating something, similarly we are eating the tablets and the syrups through the oral route. Okay, so it is a natural way of the or natural route for the drug administration. Next one is includes a big variety of dosage form. म्हणजे या ओरल रूटला व्हरायटी असू शकते. इट मे बी द कॅप्सूल इज टेकन, टॅबलेट इज टेकन, sugar coated tablet is taken, some granules are taken, syrups are taken, emulsions are there, some powders are there. So many actually dosage forms are available which are given by this route. Next one is economical and safe to the patient. It is economical because it cannot require many accessories. Okay, so directly you can wrap out the tablet or the things and you can take that particular dose to the oral route. Okay, one another thing is safe. Why safe? Because when we are taking some drug, its effect not started within the minute or within the second. It takes the time, so the symptom slowly develops, or the relief or whatever it may be side effect slowly develops. Okay, so that's as compared to these other forms, it is a somewhat safe one, because the reaction which is a favorable or non-favorable like the side effect, the effects are slow, and that's why it will be monitored. Next one is no nursing is required, which means the patient can take it with no help. कोणाची गरज नाही, स्वतःच्या स्वतः पेशंट आहे तो घेऊ शकतो. नेक्स्ट वन, टॉक्सिसिटी इज डिलेड. आता मगाशी आपण बोललो की टॉक्सिसिटी इज डिलेड ड्यू टू द लेट ऑनसेट ऑफ ऍक्शन. स्लो ऍक्शन होते, त्यामुळे टॉक्सिसिटी सुद्धा त्याची डिले होऊ शकते. ओके, सो मॉनिटर केल्यानंतर पेशंटला काय प्रॉब्लेम असेल तर त्याला त्याच्यावरती रेमेडी लगेच देता येऊ शकते. ओके, त्यामुळे त्याची जेवढा स्लो ऍक्शन मध्ये त्याच्यावरती काय जो डायव्हर्स किंवा ऍडव्हर्स इफेक्ट होईल, तो इफेक्ट वरती त्याच्यावरती रेमेडी पण देता येऊन त्याला रिकवर पण पटकन करता येऊ शकते. इट नॉट हॅपन्स स्पेशली द थिंग इज गिवन बाय इंट्राव्हेनस रूट. ओके, नेक्स्ट वन इज अ डिसएडव्हान्टेजेस ऑफ ओरल डोसेस फॉर्म. सो ऍडव्हान्टेजेस बघितले आपण. व्हॉट आर द डिसएडव्हान्टेजेस ऑफ ओरल डोसेस फॉर्म? फर्स्ट वन इज delayed onset of action because absorption takes time. जो त्याचा आपण ऍडव्हान्टेज मगात म्हटलं तोच त्याचा डिसएडव्हान्टेज आहे की त्याची ऍक्शन व्हायला वेळ लागतो, उशीर लागतो, तो त्याचा डिसएडव्हान्टेज आहे. सेकंड थिंग इज नॉट सुटेबल इन इमर्जन्सी अँड फॉर अनकॉन्शियस पेशंट. इमर्जन्सी मध्ये म्हणजे आपल्याला म्हणतो की द ऍक्शन रिक्वायर्ड विदिन अ सेकंड और विदिन द मिनिट अँड इट टेक्स अ प्रोलॉंग्ड टाइम लाईक द 1 hour 2 hours so on. So in that case, this route is not preferred one. So it is a disadvantages of this route. Okay, and if the patient is unconscious one, then this route will not the choice of the route for drug administration. Next one is not convenient for a patient with a gastrointestinal disorder such as diarrhea, constipation, ulceration, and hyperacidity in stomach. It is actually a problematic condition for the drug administration by the oral route. Suppose the patient is continuously vomiting. So if the thing is given by the oral route, that will be the thrown away by the mouth. Okay, so the effect will not possible in that case. Some patients having diarrhea means like the dysentery is there. So that particular drug not remains for the prolonged time in the gastrointestinal tract. So small amount of the drug will get absorbed and goes into the bloodstream. So the desired effect is not actually given by that particular drug when patient suffering from diarrhea. Similarly, some patients having the problem like the constipation, ulceration and hyperacidity. Okay, here also same type of the problems occur. Okay, so in that case it not becomes the choice of route for the drug administration. Sometimes the medication itself is the cause of such problems in the gastrointestinal tract, like aspirin. Means what's happened? NSAID means non-steroidal anti-inflammatory drugs like the aspirin, which may lead to ulcer in the stomach upon recurrent uses of the long time. म्हणजे काही ड्रग अशी आहेत की इटसेल्फ ड्रगच जर का वारंवार घेतली गेली तर त्याच्यामुळे स्टमक मध्ये अल्सरेशन होऊ शकतं. सो इन दॅट केस भरपूर वेळा की बऱ्याच काळ जर का अशा टाईपची औषधं द्यायची असतील, घेतली जात असतील, तर त्या केसमध्ये हा ड्रगचा रूट आहे तो अल्टर करायला लागेल किंवा चेंज करायला लागेल. नेक्स्ट वन इज अ नॉट अप्रोप्रिएट इफ द पेशंट सफर्स क्रोनिक वॉमिटिंग. मग अशीच आपण डिस्कस केले, सो आय एम नॉट रिकॅप्युच्युलेटिंग द थिंग. Not convenient if the patient suffers malabsorption syndrome, in which absorption through small intestine is not ensured. अशा टाईपचा प्रॉब्लेम जर का माल ऍब्सॉर्प्शनचा प्रॉब्लेम असेल तर त्या केसमध्ये सुद्धा हा रूट आहे तो प्रिफर केला जाऊ शकत नाही. नेक्स्ट वन इज नॉट ॲडेक्वेट फॉर मेडिकेशन्स लायबल टू inactivation or destruction in gastrointestinal tract. Example, insulin is a protein. Insulin is a protein. If taken orally, it digested in the stomach like the protein present in the food such meat and fish. मगाशी तुम्हाला सांगितलं की it gets digested like a protein and the effect of the insulin will not be given by the insulin if it is taken by oral route. Okay. And last disadvantage is nothing but the not good choice in case of uncooperative patient as the children's and infants. Uncooperative patient म्हणजे आपण गोळी दिल्यानंतर तोंडात ठेवून द्यायची, थुकून द्यायची, गिळायची नाही, असे जे पेशंट्स आहेत म्हणजे स्पेशली द चाइल्ड किंवा इन्फंट, अगदी लहान मुलं आहेत, त्यांच्यासाठी हा रूट आहे तो प्रिफरेबल रूट असू शकत नाही. ओके, सो these are the actually disadvantages of the oral route of drug administration. Okay, so we are moving towards the next route, which is nothing but the before going to discuss the next route, just we are considering various actually forms which is given by the oral routes are the tablets, then capsules, oral suspension, emulsions and lozenges. टॅब्लेट्स माहिती आहेत आपल्याला, कॅप्सूल्स माहिती आहेत आपल्याला, ओरल सस्पेन्शन्स माहिती आहेत, इमल्शन्स माहिती आहेत. आम्ही डिटेलमध्ये आपण वी आर गोइंग टू डिस्कस आफ्टरवर्ड्स दिस फॉर्म्युलेज. अँड लॉजेन्स मीन्स द च्युएबल्स, आपल्याला की जे आपण ज्या गोळ्या चुकून खातो आपण स्पेशली खोकल्यासाठी, थ्रोट इन्फेक्शनसाठी, दिस कम्स इन टू दिस कॅटेगरी. ओके, सो दीज आर सम एक्झाम्पल ऑफ द व्हरायटी ऑफ डोसेस फॉर्म्स. नेक्स्ट वन इज अ parenteral route of drug administration. Parenteral route of drug administration. Per means beyond आणि enteral means intestine. So intestine ला bypass करणारा कोणताही रूट आहे त्याला आपण म्हणतो parenteral route. Okay, so this refers to the administration by injection which takes the drug directly into the tissue fluid or bloodstream without having to cross the intestine mucosa. So you can see the picture here. Injection, the nurse is actually filling the syringe, and when it filling the syringe, what's happened to the patient, you know that already well. So here I am showing one picture with GI image. So this is one type of the uncooperative patient. So how many people are required here to give this injection? So this required help of variety of the peoples. If the patient is uncooperative, then the number of peoples goes on increasing. So that's why actually it is actually a disadvantage. You can say that the injection route. What are the advantages? Okay, बघूया आपण advantages काय आहे. First one is action is a faster and definite which is suitable for emergencies. Action आहे ती फास्ट आहे आणि डेफिनेट आहे, त्याच्यामुळे इमर्जन्सी मध्ये हा रूट आहे तो सुटेबल आहे. नेक्स्ट वन इज अ गॅस्ट्रिक इरिटेशन अँड वॉमिटिंग आर नॉट प्रोवोक्ड. मीन्स ज्याला गॅस्ट्रोइंटेस्टिनल ट्रॅकशी रिलेटेड डिसीजेसचा किंवा प्रॉब्लेम्स आहेत त्याच्यासाठी हा रूट आहे तो प्रिफरेन्शियल असू शकतो. Can be employed even in unconscious, uncooperative and vomiting patient because we are going to bypass the gastrointestinal tract. So no question at all, in such a cases or such a patient can be treated by using this parenteral route. Next one is the no chance for interference. No chance for no change of interference by food for digestive juice and liver is bypassed. Already discussed, I am not repeating the thing. What are the disadvantages? बघूया आपण. First one is the preparation has to be sterilized because the drug is directly given into the bloodstream. So if the syringe is not sterilized even, it may causes some infection. So the preparation must be sterilized. Then it is costlier. It is costlier. Why? Because to give the drug by this route, we require syringe, then nurses are required. So some instruments or apparatus are required to give this the medicament through this route. So that's why it is a costly. Next one is technique is invasive and painful and assistance is required. जेव्हा इंजेक्शन दिलं ते काय कोणी आवडीने घेत नाही, आपल्याला माहिती आहे. समवॉट पेनफुल इज वन डिसएडवांटेज अँड चान्स ऑफ लोकल टिश्यू इंजुरी अँड इट इज अ रिस्की ॲट अ टाइम. मेनी टाइम्स एकाच जागेवरती जर का इंजेक्शन दिलं गेलं तर तिथले टिश्यू आहेत ते डॅमेज होऊ शकतात. इन फ्यू केसेस स्पेशली द पेशंट विच इज सफरिंग फ्रॉम द डायबेटिक्स, diabetes 1 means type 1 juvenile onset diabetes, insulin is continuously given, okay, before the food. So continuously insulin means during the day 2 times the insulin is given or 3 times the insulin is given, depends upon the insulin deficiency or the severity of the diabetic condition. So when it given to the specific place, एकाच जागेवरती continuously दिलं, so maybe there will be probability of the cancerous growth of the tissues or the cell at that position. Okay, so this will be the danger of the disadvantages of the parenteral route. आता regarding the parenteral route बघूया आपण कोणकोणते आहेत. One is the intramuscular route. Injected into the skeletal muscle deeply. Then subcutaneous route means injected through the layers of the skin into areolar tissue below the skin. Areolar tissue below the skin. Next one is a intravenous route, injected directly into the vein. Next route is a intrathecal route, injected into spinal fluid. Injected into spinal fluid. We just having injection घेतलं एवढंच माहिती आहे, पण these are actually the types of the injection given to for the variety of the diseases. Okay, next one is the intra-arterial route or intra-arterial route, injected into the artery, directly artery मध्ये inject केलं जातं. Then intracardial, it is in a severe condition, especially directly हृदयामध्ये किंवा आपण directly heart मध्ये inject केलं जातं. Then intradermal, injected in a dermis. Okay, then intracutaneous, which is the injected in a epidermis. Then next one is the intramedullary, means injected into the bone marrow. then intraperitoneal, injected into the peritoneum. Okay, so here we can see the figure is here. Intramuscular, injected into the muscle, subcutaneous, here the subcutaneous tissues are there, so there is injected, then it is considered as the subcutaneous. Okay, when it is injected into the vein, then we considering it as intravenous. आपल्याला आठवत असेल तर बघा की आपण ब्लड द्यायला जातो किंवा रक्त द्यायला जातो किंवा आपण काहीतरी ब्लड चेक करायचं असतं, तर ते आर सर्चिंग फॉर द वेन्स. ओके, अँड आफ्टर दॅट when they find the proper vein for the injection, they inject to the vein and they remove the blood. Similarly, into that particular vein, what's happened, the drugs are given, so that route is considered as a intravenous route. And next one is when it is injected into the dermis, then we considering it as a intradermal route. Okay, so regarding the routes, especially when the injection is given by intravenous, the effect will be within a 30 to 60 seconds. Very fast route, or very greater rate of the response by that particular route when the drug is given by the intravenous route. So here sublingual route is there, which gives the response within a 3 to 5 minutes. Inhalation, again 2 to 3 minutes. Endotracheal, it gives the 2 to 3 minutes, result in a 2 to 3 minutes. Okay, rectal routes gives the result in a 5 to 30 minutes, and so on. Okay, so these are actually why I am showing this is not part, but I am showing this the rate which required. मगाशी आपण बघितलं होतं की डिपेंड्स अपॉन द रेट. आपण बघतो की रूट ऑफ ड्रग ऍडमिनिस्ट्रेशनचा चॉईस आहे तो चेंज होत जातो. ओके, आपल्याला वी आर फॅमिलियर विथ ओरल रूट. आपल्याला माहिती आहे की पोलिओचा डोस आहे तो तोंडावाटे दिला जातो, रोटा व्हायरसचा डोस. देन हिपॅटायटिस बी ची जी इंजेक्शन आपल्याला लहानपणी दिली जातात, दिस गिवन बाय द इंट्रामस्क्युलर रूट. देन येलो फिवर सारखी जी ज्याच्यासाठी जी प्रिव्हेंटिव्ह ऍक्शन म्हणून जी आपल्याला वॅक्सिन्स दिली जातात ती सबक्युटेनियसली दिली जातात. आणि आपल्याला वेल नोन माहिती आहे की बीसी जे आपल्या खांद्यावरती आपल्याला कुठेतरी डाग असेल आपल्याला की जिथे इंजेक्शन दिलेलं आहे, जे इंट्राडर्मल मध्ये दिलेलं जातं, फुगा येतो, आपल्याला माहिती आहे की थोडस फुगा येतो आणि नंतर बसतो, आणि तो मार्क येतो कायमस्वरूपी राहतो, विच इज नथिंग बट द इंट्राडर्मल रूट. ओके, then we are moving, these are actually here up to this point we are discussing the various routes for the drug administration. Okay, so here we are going for the formulation and different dosage forms. Okay, so drug formulation is a composition of pharmaceutical product or the operation required to produce a pharmaceutical product may contain one or more drug together with areas, excipient and adjuncts. थोडक्यात ड्रग फॉर्म्युलेशन म्हणजे काय की अनेक ड्रग्स किंवा अनेक औषधांचं एकत्रित मिश्रण, म्हणजेच काय म्हणतो आपण त्याला फॉर्म्युलेशन, किंवा त्याला म्हणतो आपण प्रिपरेशन असं म्हणता येईल. फॉर्म्युलेशन म्हणजे आपण जेव्हा एखादं औषध घेतो, नुसती टॅबलेट जरी घेतो आपण, that tablet contains multiple drugs, maybe contains multiple drugs. Again, it contains some filthy material to increase the size of the tablet, because the content is very small and the tablet is very small, then it becomes difficult to handle that tablet, so it becomes required to increase the size of tablet. So for that various things are done. So all this comes under the formulation. Okay, when two or more active pharmaceutical ingredients are combines in a fixed ratio in a single dose, म्हणजे एकापेक्षा जास्त औषधं जर एकाच सिंगल डोस मध्ये असतील, then it is known as fixed dose combination, FDS. It is known as fixed dose combination. Next one is a combination formulation. we are using many number of things. Many numbers of things is combined to prepare the tablets, syrups, emulsion, and so on. Okay, so these ingredients we have to consider here. First one is a binder. Binder, especially it is actually used for the binding purpose. So they are actually used to convert a free flowing powder containing mixture of ingredient into the tablet, so these are considered as a binders. Then next one is a fillers. What is meant by the fillers? Fillers means to increase the size of the syrup, tablet, whatever it may be, some ingredients are added. That ingredients are considered as a filler. Then next one is disintegrants. This disintegrate actually facilitate the disintegration of the tablet in the gastrointestinal tract. म्हणजे गॅस्ट्रोइंटेस्टिनल ट्रॅक मध्ये त्याचं डिसइंटिग्रेशन फॅसिलिटेट करण्यासाठी किंवा वाढवण्यासाठी म्हणून ज्या गोष्टी त्याच्यामध्ये ऍड केल्या जातात, लाईक अ स्टार्च, त्याला म्हणतात डिसइंटिग्रंट्स. ओके, नेक्स्ट वन इज अ लुब्रिकंट्स. लुब्रिकंट्स स्पेशली युज्ड, जे टॅबलेट्स तयार होतात त्या टॅबलेट ज्या साच्यामध्ये तयार होतात किंवा ज्या आपण म्हणू मोल्ड्स मध्ये तयार होतात, त्याला ते स्टिक होऊन राहू नये याच्यासाठी काही लुब्रिकेटिंग मटेरियल त्या टॅबलेटच्या आउटर कोटिंग्स मध्ये वापरलं जातं किंवा पावडर मध्ये इट सेल्फ वापरलं जातं, त्याला म्हणतात लुब्रिकंट्स. नेक्स्ट वन इज अ कलरिंग एजंट. व्हाय द कलरिंग इज रिक्वायर्ड? बिकॉज इफ वी आर टेकिंग 5 tablets at a time, so all the tablets are looking the similar, then it becomes quite difficult to find out which tablet is of which drug. So to differentiate the drug from each other, many times some colors are used to coloring that particular tablet to differentiate the tablet from each other. Okay, so these agents are nothing but the coloring agents. Okay, so you from this list you can get idea that how many things are added into a specific drug. We are just taking one tablet, but these are the ingredients of the tablet as well as the syrup or variety of the things we are taking as a drug. Okay, next one is a flavoring agent. If we are taking some syrup and that syrup having not proper taste, some bitter taste is there, so some sweetening agents or flavoring agent which gives the pleasurous feeling for us, so some flavoring agents are also added. So in food or when we are baking something, we are adding the flavoring agents. Similarly in tablets or in drugs, actually some flavoring agents are added. Okay, next one is the preservatives. जी ड्रग्स तयार झालेले आहेत ते डिकम्पोज होऊ नये म्हणून त्याच्यामध्ये काही प्रिझर्वेटिव्ह आहेत ती ऍड केली जातात. ओके, त्याचं डिकम्पोजिशन, ऑक्सिडेशन आहे ते थांबवण्यासाठी म्हणून त्याच्यामध्ये प्रिझर्वेटिव्ह आहेत ती ऍड केली जातात. अँटीऑक्सिडंट्स, ऑक्सिडेशन होऊ नये, ऑक्सिडेशन होऊन त्या ड्रगचं दुसऱ्या कुठल्या तरी कंपाऊंड मध्ये कन्व्हर्जन होऊ नये, ते रिस्ट्रिक्ट व्हावं याच्यासाठी काही अँटीऑक्सिडंट्स पण त्याच्यामध्ये ऍड केले जातात. And next one is a suspending agent. Suspending agents are actually hydrophilic colloids that form colloidal dispersion with water. Alginic acid, then sodium carboxymethyl cellulose are this type of the suspending agent. So they forms the colloidal dispersion. So for few cases actually these type of the suspending agents are required. Okay, then we are moving towards the next point, which is nothing but the various dosage form. First dosage form is a aerosol. Aerosol is nothing but the suspension of fine solid or liquid particle into gas. आपल्याला माहिती आहे की जे स्प्रे मिळतात आपल्याला, स्पेशली आपल्याला माहित असेल तर आपल्याला जेव्हा काही मुकामार लागला असेल, सम इंजुरी इज देअर, ओके, अँड सम इन्फ्लेमेशन इज देअर, त्यामध्ये आयडेक्स पासून अनेक गोष्टीचे स्प्रे मिळतात. दीज आर नथिंग बट द एरोसोल. ओके, मीन्स एरोसोल्स मीन नथिंग बट द सॉलिड और लिक्विड इन particles in the gas is nothing but the aerosol. Okay. The next one is the application. Applications are nothing but the fluid or semi-fluid preparation, especially utilized for application on the skin. फ्लुइड किंवा लिक्विड किंवा सेमी फ्लुइड किंवा पूर्ण फ्लुइड नेचर असलेले जी काय आपण म्हणू की जे मेडिकामेंट आहे जे स्किन वरती वापरलं जातं त्याला म्हणतात ऍप्लिकेशन्स. ओके. नेक्स्ट वन इज अ कॅप्सूल. वी आर फॅमिलियर विथ दॅट. आयदर द कॅप्सूल इज ऑफ this type or completely coated capsules are there. The material is actually when goes into the gastrointestinal tract, the outer coating gets dissolved and get dispersed into the gastrointestinal tract for the absorption. Okay. Next one is collodions. Collodions means actually are the fluid preparation containing volatile solvents and used for external preparations. कोलोडियन्स म्हणजे काय की व्होलाटाईल सोल्युशन मध्ये काय मेडिकामेंट्स टाकलेले असतात. म्हणजे काय होईल की व्होलाटाईल सॉल्व्हंट वरती लावल्यानंतर आपण जर लावल्यानंतर ते काही काळानंतर काय होईल स्किन वरती समजा अप्लाय केलं आपण ते तर काय व्होलाटाईल लिक्विड आहे ते उडून जाईल आणि मेडिकामेंट्स आहे ते त्या जागेवरती राहील. म्हणजे अशा पद्धतीची जी फॉर्म आहे त्याला म्हणतो कोलोडियन्स. ओके. स्पेशली पावडर वगैरे ज्या गोष्टी आहेत की ज्या सरफेस वरती बाइंड होऊन राहायला पाहिजे असतील तर त्याच्यामध्ये कोलोडियन्स फॉर्म मध्ये सुद्धा वापरल्या जाऊ शकतात. नेक्स्ट वन इज अ क्रीम. क्रीम आपल्याला माहिती आहे. नेक्स्ट वन इज अ डस्टिंग पावडर. डस्टिंग पावडर आपल्याला जी पेस्ट पावडर लावतो सिमिलरली फॉर उन्हाळ्यामध्ये आपल्याला माहिती असतील की फंगल इन्फेक्शन साठी ज्या पावडर्स अवेलेबल आहेत त्या दीज आर द डस्टिंग पावडर्स. ओके. देन वी आर कन्सिडरिंग ड्रॉप्स. ड्रॉप्स वेगवेगळ्या प्रकारचे असू शकतात. आय ड्रॉप्स असू शकतात, इयर ड्रॉप्स असू शकतात. सो दीज आर द ड्रॉप्स. ड्रॉप म्हणजे काय लिक्विडच आहे फक्त ते एक वेगळा पॅटर्न म्हणून आपण ड्रॉप टाकायचं म्हणून आपण त्याला ड्रॉप हा डोसेसचा फॉर्म आपण कन्सिडर केलेला. नेक्स्ट वन इज इमल्शन्स. Next one is a emulsion. Emulsion is nothing but the oil dispersed in water. Emulsion is nothing but the oil dispersed in water. Means oil in water is nothing but the emulsion. The cremaphin, constipation साठी दिलं जाणारं औषध आहे cremaphin. Paraffin आहे. Paraffin which is a dissolve म्हणण्यापेक्षा which is a dispersed in the water. शेक करून डिस्पर्स केलेलं जातं and it is considered as an emulsion. Okay. Cremaphin. Next one is enema. Enema is directly given into the rectum. Next one is the gels. There is a slight difference between the gel and creams, and I think we are familiar with the cream and gels. Okay. Next one is the inhalants. Inhalants मध्ये आपण बघतो की Vicks is here, then salbutamol. Okay. So these are inhalers म्हणून जे काय असतं आपल्याला. So these are the form dosage form which is nothing but the inhalants. Then granules. The small particles or small granules either they are capsulated or other directly they are given. Okay. Vitamin D3 also available in the granules. Sachets are available of the vitamin D3 and then granules in a granule form. And many times actually these granules are capsulated if they having not proper taste or irritating taste or the bitter taste. Okay. The next one is a tablets or pill. So tablet when depends upon the size, the small size of tablet is considered as a pill and bigger are considered as a tablet one. Okay. So we are familiar with this. The next one is the suppositories. Suppositories are directly inserted into the anus. Suppository directly inserted into the anus, especially the patient which suffering from the constipation. In that patient, actually the suppository are utilized. Okay. The next one is the patches and adhesive. Skin वरती आपल्याला माहिती आहे की स्किनवरती काही प्रॉब्लेम असेल, काही इन्फेक्शन असेल, तर इन दॅट केस ऍक्च्युली किंवा काही पेन्स असेल तर त्या केसमध्ये काही चिकटवायच्या पट्ट्या आपण बघतो, स्पेशली पॅचेस चिकटवले जातात ऍडेसिव्ह असलेले, त्याला आपण म्हणतो पॅचेस अँड ऍडेसिव्ह. सो दीज आर व्हेरियस डोसेस फॉर्म्स. ओके, we are moving towards the next or the important point, which is nothing but the sustained release formulation. The sustained release formulation used a polymer for encapsulation of drug or as a vehicle for carriage of drug, which protects the active agent during its passage through the body and control its release until it reaches the active site. What's happened exactly? If we are taking the drug and that particular drug will go into the gastrointestinal tract and the reaction started, it gives the corresponding response, we are getting the relief, but it will get removed from our body after few times or after few minutes. Okay, but if we require the effect for the prolonged period, in that case actually the drug granules or the capsules are used which dissolves after specific time interval. So first dissolves suppose after 15 minutes, second dissolves after 30 minutes, next dissolves after 45 minutes. So we are getting complete actually the action, continuous action for the prolonged period. So these type of the formulations are considered as a sustained release formulation. These type of the formulations are considered as a sustained release formulation. What are the advantages of the sustained release formulation? First one is selective delivery to the required site and hence they are more effective. By this formulation, the delivery of drug will be possible at the desired site. ज्या ठिकाणी त्या औषधाचा उपयोग व्हायला पाहिजे त्या ठिकाणीच डिलिव्हरी पॉसिबल होऊ शकते बाय युझिंग द सस्टेन्ड रिलीज फॉर्म्युलेशन. नेक्स्ट वन इज अ डिलिव्हरी ऍट अ रिक्वायर्ड रेट और ऍट अ रिक्वायर्ड इंटरवल. प्रिव्हियसली डिस्कस, आपण जर का कॅप्सुलेशन असं केलं की एका स्पेसिफिक पीएच ला जर का त्यावरचं कोटिंग डिझॉल्व्ह होत असेल तर आपल्याला तो दिलेला ड्रग आहे तो इंटेस्टाईन मध्ये जाऊन डिझॉल्व्ह होईल किंवा इंटेस्टाईन मध्ये ओपन होईल, स्टमक मध्ये ओपन होईल की आपल्या इसोफेगस मध्ये ओपन होईल, हे आपल्याला डिसाइड करता येऊ शकतं. सो याच्यावरून आपल्याला त्याची जी डिलिव्हरी आहे ती डिलिव्हरी किती वेळानंतर आणि कोणत्या रेटने किंवा आपण म्हणू कोणत्या स्पीडने डिलिव्हरी व्हायला पाहिजे हे आपल्याला कंट्रोल करता येऊ शकतं बाय युझिंग द सस्टेन्ड रिलीज formulation. Then it's having the fever applications. Then it reduces the danger of overdose of side effect. Sustained हळूहळू थोड्या वेळाने रिलीज होणारं फॉर्म्युलेशन आहे, त्याच्यामुळे काय होऊ शकतं, इट रिड्युसेस द डेंजर ऑफ ओव्हरडोस एज वेल एज द साइड इफेक्ट. ओके, नेक्स्ट वन इज एंट्री ऑफ मॉइश्चर इज प्रिव्हेंटेड ड्युरिंग स्टोरेज. कॅप्सुलेशन केलं किंवा त्याला कोटिंग जेव्हा केलं जातं तर ऑटोमॅटिकली जे आतलं ड्रग आहे त्याचा कॉन्टॅक्ट मॉइश्चरची आहे तो कमी होतो, त्याच्यामुळे ड्रग आहे ते प्रोटेक्टेड राहू शकतं. त्यामुळे जसं सस्टेन्ड रिलीज फॉर्म्युलेशनचा हा एक आणखी ऍडव्हान्टेजेस आहे की ते इट प्रिव्हेंट्स द ड्रग स्पेशली फ्रॉम द मॉइश्चर. ओके, ऑर वी कॅन से दॅट फ्रॉम द ॲटमॉस्फिअर चा जो इफेक्ट व्हायचा आहे तो त्याच्यावरती इफेक्ट होऊ शकत नाही. ओके, सो हिअर विथ ऍक्च्युली वी आर गोइंग टू कन्क्लूड आवर लेक्चर. In this lecture, we consider the various type of the routes for the drug administration. Then we consider the choice of the route or the factors which governs the choice of the route. Then we consider various actually ingredients which is added for the drug formulation, and then we discussed the sustained release formulation. Okay, so thank you for your patience listening. So herewith I am going to conclude this session. Okay, thank you all of you. Thank you.